Cukup Setakat Samson, bantras korban denggi habis-habisan.
Assalamualaikum dan salam sejahtera. Kami tidak akan dan tidak pernah akan melupakan Samson dan perjuangan untuk memerangi denggi ini untuk habis-habisan. Dalam konteks itu berlangsung satu persidangan yang cukup penting di Hotel Intercontinental Kuala Lumpur, dan ia adalah tentang Kongres untuk penyakit tropika dan parasitologi di ASEAN, dan ini adalah Golden Jubilee 50 tahun. Dan di situ saya telah berjumpa dengan ramai pakar dalam bidang penyakit tropika dan juga parasitologi, virus dan sebagainya. Malam ini saya mengambil keluar seorang pakar yang datang jauh dari Geneva, dari Pertubuhan Kesihatan Sedunia ataupun WHO. Oleh itu saya ingin meminta izin untuk berbicara dalam bahasa Inggeris kerana untuk betul-betul melunaskan janji Cukup Setakat Samson, kita memerlukan pendekatan yang begitu strategik. With that, I would like to speak in English, and I would like to welcome Dr. Rahman Velayudan. Thank you so much for making time. Dr. Rahman is the coordinator for the Vector Ecology and Management Department of Control of Neglected Tropical Diseases of WHO, based in Geneva. And Dr. Rahman presented an outlook of a global strategy to fight dengue. And he closed, or at the end of the presentation, by saying that this is the disease for the future. I understand that a lot of people here were saying, yes, we have this disease now, but that's just implying that if we don't really pull together, coordinate, and really fight this virus, it will be even bigger and affect more people, more countries in the future. With that in mind, because the name of the department where Dr. Rahman works is called Neglected Tropical Diseases, so I would like to start with that, because I believe personally that awareness is still not at sufficient level across all sectors. The people, the departments involved, government or otherwise. So what are your views on that? Because on the global level, in the WHO website, I can see statistics like over the last maybe 50 years, 30 over increase in the sense that if it's such a big increase, meaning what we are doing is not sufficient, and in order to break that, why don't we approach it in a global level rather than very fragmented approach?
Thank you. It is exactly the point is dengue is a very peculiar disease for many reasons. One, it can be a very simple flu-like illness for 3 days and you get over it. And secondly, if it is not that way, in some percentage of the people, it may become a severe dengue, severe disease, and you may need hospitalization. So because it has such a wide spectrum from a simple illness to severity, we are not in a position to correctly count all the cases, because many people with simple fever may not come to a health center at all. So one challenge we face is that we still need to ascertain the global burden of the disease, and we are trying to do that with partners and come up with the right methodology in the next few years, so that at one particular time we would be in a position to say that dengue is the real dengue situation is much bigger, and highlight that to the government leaders that this is a serious issue and we need to address it in a more comprehensive manner.
I remember you made a point that says that since for the first time since 2010, there's no region in the world that's not affected by dengue. That shows that dengue has found a way to move faster than humankind in terms of fighting for survival. So they're going to new areas. They are now in Australia, in Europe. You know, a lot of people here wouldn't think that there's dengue in Europe, but we know they have the vectors there also. So how do you look at that? Because if the spread of dengue is getting faster and larger, so coordination needs also to match, if not beat that.
Yes, this is precisely the point we are trying to emphasize, that, for example, just to give an example of places like Europe, the last dengue outbreak in Europe was somewhere in 1920s, and then after that they have never had dengue.
Okay.
But then now, after a space of nearly 75 odd years, it has come back. And of course, there was, luckily, the number of cases are few, less than 100, except in Madeira, Portugal, where they touched almost 2,300 cases. So the disease there is a potential for it to really break out, and now the countries are encouraged to really take action in properly doing a surveillance of the vector and control the vector first, so that once you keep the vector at a lower level, then the transmission potential is less.
Doctor, you make the point, and I can feel it in your presentation even now, that you feel that more attention, especially from leaders, could be given to this. But maybe if we were to put that across to the public, if you can put to us maybe a comparison between, for example, malaria and dengue. Maybe just because dengue kills lesser amount of people, it doesn't get attention as big as the other disease.
It is the number of people suffering from dengue and malaria are very comparable in terms of figures right now. But having said that, yes, you are right that the number of deaths is significantly less in dengue as compared to malaria. But with the MDG goals, when it was set up by the turn of the century, it was great that malaria got recognized as one of the diseases to be tackled by 2015, and it was put in the MDG. And as a result of that, plus the origin of the Global Fund for the 3 diseases, all this really brought in a significant amount of resources for malaria control. So we are beginning to have an impact on that.
Okay. Doctor, we have to go for the first break, but once we are back, sometime we've got to decide, because there's not enough resources. A lot of people are saying, why can't we find a vaccine in the 21st century? But other people are saying, put more money into basic research so that we identify this virus better, how it acts, what does it do, why do some people get hemorrhagic fever, but others, they show no symptom of that and they recover well. So that we'll discuss after this short break.
Thank you.
Cukup Setakat Samson, pantras korban dengue habis-habisan.
Cukup Setakat Samson, or Let Samson Be the Last. Samson was my colleague in Awani, but he passed away last Sunday because of dengue. And because of that, I'm having Dr. Rahman Velayudan from WHO here, and we've discussed how Dr. Rahman works in the neglected tropical diseases department, and dengue is one of it. And that shows that, you know, awareness has not gone as well as we hope for it to be. And however, I know there's a lot of philanthropy activities, also NGOs contributing and working together with bodies like WHO, the Gates Foundation, for example. But how do you decide on which area to fight dengue that you put more resources to? Because even in this country, and we've been fighting it for decades, a lot of focus has been on fighting the vector, which is a mosquito. But there are new findings, new research, and also old ones that are saying that maybe we should know the virus and look at the virus more, because that's where the real fight is. Can we really make sure that there's not a single Aedes aegypti or albopictus around? Or isn't it better to know the dengue virus itself? For example, at WHO, where you're sitting in Geneva, how would you and your colleagues look at this?
Well, what we are really looking now is how this all the methods of control and prevention can work together. So On the vector side, we are looking at vector control tools which can be effective, and as you might have heard in the presentations, there are some new tools coming in, and some of them may be good enough to be implemented. And on the other side, the vaccine group has developed, there are at least 3 to 4 candidate vaccines which are undergoing various stages of trial. So, but the issue is right now we still do not have one which can be licensed and used. But even if one comes in, there are several other questions to be answered. We have to prioritize whom we are going to give the vaccine. The cost factors come into play. The coverage factor come in. How many doses comes into play. All this have to be included. But having said that, having learned the lesson from other similar diseases, it is time we are really looking at how these two, vector control, vaccines and surveillance, all work together to address the problem of dengue.
Which side is more advanced in being looked at now? Because you look at both. And from a global perspective, you know, because we also have a lot of young people out there, so maybe they should take it as their cause to go and be a scientist, for example, scientists whether to fight the vector or whether to fight the virus. But if you can paint the picture of where are we at now globally on this particular front.
Well, essentially the challenges are enormous. On one side we have a vector which breeds in and around houses, and in an urban situation to control it is a challenge. But having said that, there are control measures which can be put in place, and we need to make sure that some of these control measures are more sustainable, which can last for 1 to 2, 3 years and can be monitored with cooperation of the community and so on. But on the other hand, the vaccine research is also advancing at the same pace, but the challenge here is we are talking of a vaccine against 4 different viruses. I mean 4 serotypes we call it. Dengue 1, dengue 2, 3 and 4. Now that is the challenge for the molecular biology group people when you devise a vaccine to tackle 4 different serotype. That's the biggest challenge. It's like one key opening 4 locks. And that's going to be so, but there is progress in it. There is definitely progress being made, and as I said, several groups have worked on it, and 3-4 candidates are on various trial. So at the end of the day, if we have a good tool for vector control, this will help to lower the density of the vector, and at the same time will prevent outbreaks. On the other hand, a vaccine can support the intervention by making sure that a certain level of population can be vaccinated so they can be prevented. But then we have to monitor how effective this vaccine is over time. So these two have to really work together to make sure that over a given period of time, say 15 years from now, we can lower the levels of dengue cases by 50% by these two. So this is what the goal is ultimately. But it depends on getting all the tools on board, working together, and with sound surveillance system.
A lot of worries are also put to the fact that 75% of the people at risk to be infected with dengue, they are in the developing or poor nations. So how would any strategy take that into account, and how would that be addressed? Because we know that the advancement of pharmacology, for example, the big pharmas are not in these countries, they are outside. So why would, let's say, research for hair loss, sacrifice money to be put to research on dengue, for example? So the commercial impact, we do know the constraint. So do you see and envisage, for example, like ASEAN, to have a closer network of pooling resources together and coming up with a solution, for example, rather than just waiting for a big breakthrough somewhere outside of these 75% people at risk areas?
Well, I would put it this way, that now many vaccines have become cheaper over time, because as things evolve, naturally there are vaccines becoming cheaper and cheaper with the consumption. So ASEAN group of countries have really shown the way in terms of advocacy for dengue by creating an ASEAN Dengue Day, and there is highest level of commitment. So definitely there is potential for ASEAN to really show the world the way. Now, the funding situation, I really can't comment on that because it's something which we really need to see how things evolve. Now, if, as I said, if there are 4 candidate vaccines in the race, and if they all come into the market, there will be competition which could lead to reduction in cost and so on.
We can only hope, but we can also work hard to make sure that we are fighting dengue for sure. I have to go for the last break, but once we are back, the global plan is there. You know, it's been formulated, it's been put to practice out there. The targets are very clear. I want to share one, which is mortality from dengue can be reduced to almost zero by implementing timely, appropriate clinical management, which involve early clinical and laboratory diagnosis, intravenous rehydration, staff training, and hospital reorganization. Sounds a mouthful, but it is very doable. I've sat in the Congress and listened to presentation. I've read the document at WHO website. I think among the things that's stopping us from really fighting dengue is awareness and putting things strategically to work. And that is very much doable. Let's talk to Dr. Rahman again after this on how do we do that and do that fast and effectively right after this.
Cukup Setakat Samson. Pantras korban dengue habis-habisan.
Awani is a very, very staunch advocate of fighting the dengue virus to the end. And Samson has given us that strength. And his passing will push us further on this. However, if we take the case of Samson was diagnosed as having fever the second day he was having it. And then he was sent back. But from the Congress and from the presentation what I read here, if at that time, the first time that anybody with a fever complains, you know, when they are screened for the first time, if at that particular point dengue can be detected, then I think it will be pretty much more efficient in us fighting dengue. But what's stopping us, Doctor, from having that as a standard practice across all the regions affected by dengue? How do we improve that?
Well, this is exactly the point of the first point of the global strategy, which is we need to address diagnosis. Diagnosis of dengue has been a challenge because to isolate the virus or to carry out the test to confirm dengue takes about 3 days, and that delay factor has to be reduced. So there is a need for better rapid tests to come into the market which can really detect dengue, and research is ongoing on that, and we are quite confident that these tools can be made available soon. So we really need a better detection and better follow-up of cases, especially on the diagnosis part. But overall, like case management, actually the medical faculty has developed very good resources. We have a curriculum in WUPRO. We also have experts in Malaysia who have contributed to the development of this. And so essentially the doctors can easily be trained on management of dengue in the hospitals, be it a dengue with warning signs or one with is severe. And once that expertise is passed on, it is achievable to reduce deaths to almost negligible level, almost zero, to be honest. And many countries have done that. There are several countries who have put the doctors and medical faculty to training, so that overall globally we are seeing a reduction in the death.
Okay. I would like to go further on that, but I guess I'll have to take a local expert. And we heard a wonderful presentation on that. Yeah. And then, you know, serotypes and all these things that I myself have to Google. But that is for another day. Before we end, you also look at the potential negative things for the future, if I can put it that way. And if we look we feel that it's bad in Malaysia, but if I look at Africa and from the presentation, it's almost like a volcano waiting to erupt. So what's the problem there? We know that even at this Congress, we heard how this virus is very adaptive, that it can travel through air travel, and so even if we manage the cases here in Southeast Asia, but frequent air travelers and stuff like that. So how do we ensure that even in Africa, this can be addressed?
Well, this we are trying to raise awareness there. Essentially, we are trying to build the basic tools to put in place a surveillance system for dengue there. In Africa, because of several other comorbidities, we call it, which is other infections, very often dengue is not detected very properly. But now with more and more improvement in lab capabilities in African region, we find that they are beginning to detect dengue, and more dengue cases are reported. So now we have come to a stage where we pool all this data, make sure that this can be confirmed, and a proper monitoring system is put in place, and present it to the political leaders to make sure they are aware of it. So then naturally this comes up on the table, and we are sure they will give it its due recognition.
Doctor, yes, climate change has its skeptics, but a lot of data, scientific and otherwise, are showing that things are not as before, if I can put it that way. So because it's a most rapidly traveling vector-borne viral disease, so how do you look at climate change, for example, in this whole equation? Because if I take what Prof. Sazali said before, even for Malaysia, he was projecting that maybe by 2020, 2025, 2030, the aging population and dengue, hemorrhagic fever, for example, that's not good. But if I put the factor of climate change, so how do you see this fight against dengue?
Well, right now we do not have a solid evidence to say that dengue will increase due to climate change. But having said that, in a basic biological terms, if the environmental temperature increases, the mosquito reproductive capacity increases, the virus multiplication rate increases. So there is potential that these things can increase in a realistic time. But having said that, we need more data on that. At the same time, climate change also could bring in problems in water supply, for example. And this is one issue in dengue. People, when there is shortage of water, they hoard water inside the house. The more water you store, you are providing breeding grounds for the mosquito.
Doctor,
those things have to be addressed.
That's a timely end for the discussion, because we are storing water right now, especially in the Klang Valley, because we have water rationing exercise. So please be very, very vigilant and careful of it being the place where the Aedes mosquito will breed. Because at this Congress also, I learned that they don't just like to just go and breed at one particular container, but they like to go to many. So thank you so much, Dr. Rahman, for coming to KL, sharing your expertise, and even coming to the show to share with the audience. Thank you so much. We hope that you and your team in Geneva will work even harder to help us fight this virus. Terima kasih banyak kepada anda, hantarkan pandangan anda sendiri melalui pelbagai platform yang Astro Awani ada. Kita ada Facebook, Twitter, Instagram, dan anda juga boleh terus muat turun aplikasi Mudalih di iOS dan Android. Cukup Setakat Samson, kita akan terus bersama berikrar memerangi virus dengue. Thank you so much.
Cukup Setakat Samson, pantras korban dengue habis-habisan.